Exciting. Um, I want to thank, Families Flourish for all their efforts to get this webinar put together. And thank you to all of you for joining us today. And as Lindsay said, my name is Chantel Wakely, and I am with the National Center on Shaken Baby Syndrome. I did want to just tell you a little bit more about my organization before we jump in. We are a nonprofit that was founded in the year 2000, which means that this year is our 25th year anniversary. So we've spent the past 25 years providing education and resources to organizations aligned with our mission to help keep babies safe. We are based in Farmington, Utah, but we support organizations nationally and internationally. We're the leaders in research-based development of abusive head trauma prevention programs, training courses, and public education campaigns. Additionally, we host an international conference every other year, and our research-based resources reach over 1 million people worldwide each year, including some North Dakota communities, which the next presenters will be discussing. So the main reason I'm here today is the period of purple crying. It is an effective research and evidence-based shaken baby syndrome and abusive head trauma prevention program that prepares parents with the knowledge and skills to help themselves and their babies safely reach those first year milestones. Purple takes an educational approach to supporting families rather than fear-based tactics like most shaken baby syndrome prevention programs. The program is based on 3 critical lines of evidence, which are shaking an infant is extremely dangerous caregiving behavior. Increased infant crying in the first few months of life is completely normal in all healthy infants. And lastly, caregiver frustration with increased infant crying is actually the #1 trigger for shaking events. So we're going to dive a little deeper into these 3 lines of evidence, starting off with defining what shaken baby syndrome and abusive head trauma is. So the Centers for Disease Control and Prevention defines shaken baby syndrome as a preventable, severe form of physical child abuse, resulting from violently shaking an infant by the shoulders, arms, or legs. And it may result from both shaking alone or from shaking with impact. And because it can be caused by both shaking alone or with impact, the term abusive head trauma is actually used more inclusively, but I'll be using both terms interchangeably throughout the remainder of my slides. So we know abusive head trauma is devastating, but how common is it? So on a national level, abusive head trauma is the leading cause of death from physical child abuse. And it's estimated that the incidence of cases is around 32 to 38 per 100,000 children per year in the first year of life, with cases peaking around 2 months after birth and fatality occurring in roughly 25% of cases. But because 30 to 40% of cases are missed at medical institutions, the actual incidence is unknown despite these prior estimations. And it's likely that the known incidence is just the tip of the iceberg of the amount of cases that are happening. And unfortunately, the outcomes of infants who are taken to hospitals is poor. In published studies, as many as 19 to 40% of babies die as a result of shaking. And of those who survive, 65 to 80% have significant long-term neurological and developmental abnormalities. So how do we know that increased infant crying is normal? Now, some of you may be thinking right now, well, duh, infants cry, we all know that. But through the years of research done on infant crying, it has shown that infants cry, and they cry a lot more than most expecting parents and even the general population would think. So our understanding of the normality of early increased infant crying started with a study by Dr. T. Barry Brazelton. So Dr. Brazelton asked mothers of healthy newborns from his practice to take home diaries and record all the fussing and crying their infants did each day for 3 months. So this figure that you see here is from his published article in 1962, which is now known as the normal crying curve. And there's two important things to notice. So first, there's a very clear increase and then decrease in the number of hours of crying and fussing the infants experienced. The onset was at about 2 weeks of age, with the peak being during that second month of life and then slowly decreasing after that. The second thing to notice is just like weight and height, there's a very large infant to infant variability in the amount of crying that the infants experienced. So what is shown in the shaded area represents about 50% of all the infants in the study. So this means that 25% of these normal babies cried less than is shown in the lower line of the shaded area, but 25% of these normal babies cried more. And all the infants in the study experienced an increase, peak, and decrease in inconsolable crying. And various studies have been conducted on infant crying patterns. And if we had more time, I would dive into them a bit deeper since they are all very interesting studies. But the bottom line of all of them is that regardless of whether the babies are born pre or full term, and despite the vast differences in caregiving behaviors and even species, all the subjects studied showed an age-related crying or distress pattern, just showing that increased infant crying is normal in all healthy infants. So how do we know that crying is the most important trigger for abusive head trauma cases? So it was hypothesized that crying is a significant stimulus for abusive head trauma, that the pattern of age-related incidents of cases should be similar to the age-related properties of the crying curve. So to take this hypothesis into account, they looked at cases by age regardless of specified triggers and laid them out in this graph. And as you can see, it's very similar to the crying curve, with the majority of cases happening under 4 months of age, with the peak number of cases happening around the peak crying time, around 2 months. But this study didn't show that crying was the actual direct cause of this form of abuse. So to further their evidence, they turned to publicly reported abusive head trauma cases. They first graphed the 591 cases in California by age, regardless of their specified trigger. As you can see, it's the top purple line, and once again, it's very identical to the crying curve and the curve on the previous study. They then looked at the 166 cases, that is the bottom blue line, that mentioned crying was the trigger for the shaking event. Once again, both very similar to the crying curve. So this study just provided that direct evidence that crying is the most important stimulus for abusive head trauma cases. So from what we've learned, it's shown us that shaken baby syndrome and abusive head trauma can be prevented because it's the only form of child maltreatment where we know the specific trigger and timing of the incidents. And since we know the trigger and timing, it can be prevented. And prevention really starts with educating parents and caregivers about normal infant crying and the frustration this crying can cause. So that's where the delivery of the Period of Purple Crying program comes in. The program is based on over 60 years of research and has two aims. First, to support caregivers in their understanding of early increased infant crying, and second, to reduce the incidence of abusive head trauma. And it comes in an app and booklet package. It contains a 10-page booklet, a unique one-time app activation code, and a parent reminder card. So parents are encouraged to download the app by whoever is giving them this information, a healthcare provider, trained provider, any professional who is seeing families with infants. And so they're encouraged to download the app and set up an account by entering in the code on the booklet and choosing a login method for future use. They can also invite up to 5 other caregivers of their baby to access their profile on their own devices just by a click of a button. That way they can share it with babysitters, grandma, grandpa, their partner, really anyone who would be looking after their baby. The mobile app is currently in English and Spanish with closed captioning available. And while the mobile app is only available in those 2 languages, the booklet is currently translated into French, Arabic, Haitian Creole, Somali, and hopefully some more to come. But the real great thing about this program is it provides all forms of caregivers with some really amazing resources. So one of the main components of the program is the PURPLE acronym. So each letter in purple actually stands for a crying characteristic infants can experience during this normal phase in their life. So the first P stands for peak of crying, where the amount of crying goes up, peaking around that second month of life. U stands for unexpected, referring to the fact that these crying bouts begin or end completely unpredictably and for no apparent reason, and they're not related to dirty diapers, feeding, or anything else that's going on in the baby's environment. R stands for resist soothing, when nothing a caregiver tries can calm the baby down. And the second P stands for pain-like face, when the infant looks like it's in pain even when it's not. L stands for the fact that these bouts are long-lasting. And the last letter E stands for the fact that the crying tends to cluster in the late afternoon and evening hours, often when the caregivers themselves are most tired and frustrated. Yeah.
I'm so sorry. It appears that more than one person is sharing their screen right now. So I think it says all people are lost the PowerPoint. So could you perhaps try to stop sharing and share again? And if anyone else is sharing their screen, please.
It looks like it says Allison Mahoney's screen is being shared. I don't know. That helps.
Allison, could you stop sharing your screen, please? Sorry, everybody. Just 1 second. Oh, it looks like we're back.
Okay, good.
Yep.
Okay, awesome. So this slide, if you had missed it, is just the acronym. So I've been going through each letter, but I think we're towards the end. So the last letter E stands just for the fact that crying tends to cluster in the late afternoon and evening hours, often when caregivers themselves are most tired and frustrated, which is just unfortunate timing. But we then preface the acronym with the word period, just to remind caregivers that the crying does not go on forever, but only for a particular period in the infant's life. So the real purpose of the PURPLE acronym is just to better prepare parents for this phase of crying and to provide a quick and memorable, easy way for caregivers to recognize and acknowledge that these crying characteristics can happen and they're completely normal. And as we know, infant crying is a big stressor, if not the biggest stressor for parents in the first few months of life. And while the acronym prepares parents for the crying characteristics, the crying curve prepares them for the timeline of their infant's crying. So being able to give them a time frame and encouraging them to utilize the Period of Purple Crying program materials during increased and peak times of crying can really help reduce the frustration that parents and caregivers experience with this completely normal phase of development. And so diving a bit deeper into what the mobile app hosts, it has a variety of exciting features, all focused on helping parents and their new baby safely reach those first year milestones. And since we know that the most common trigger for abusive head trauma is crying, the app and booklet helps to normalize crying, but it also hosts so much more information than just crying characteristics. So some of the content available to families within the app includes access to our Period of Purple Crying video, which is a parent testimonial. It shows real parents that went through the same thing these new parents are now experiencing. We have a Crying, Soothing, and Coping, Doing What Comes Naturally video, and a digital copy of the booklet. Now, parents can also explore other exciting features of the app, which include content sections on obviously crying characteristics, but also various soothing techniques, coping strategies. We talk about safe sleep recommendations and best practices. There's stuff on there about infant safety and even self-care strategies for parents. So each of the sections includes articles and videos pertaining to those topics. And the app also includes a baby development tracker that allows parents to track feeding, crying, sleeping, diaper changes, pumping, measurements, and even vaccinations of their baby all in one place. And then it lays out the data in graphs that allows the parents to see their infant's growth and change over time. We also have a dad's handout. So this supplemental material is not required to be purchased to participate in the Purple program, but it is available for those who feel like they need it. So this handout is to be given directly to the father figure to help engage him in the education, as well as provide them with important information about their attachment with their baby. And it also directs the father back to the app to encourage him to download it himself and to review the articles and videos that may be applicable to him. Some studies that have been found on perpetrators of shaking events found that fathers are actually the most common perpetrator, with parent partners second and mothers third, and then babysitters and other adults following after that. So this really just demonstrates the importance of all caregivers being engaged in prevention education. Another interesting study found that children under 1 year of age with siblings that are under the age of 5 years were more likely to be injured by their biological parents. So showing once again the importance of educating all forms of caregivers and supporting families with newborns during all the developmental stages ahead, no matter if they've had children before or not. So I wanted to briefly share some of the research supporting the program materials. So the delivery of the program has been studied for over 18 years and has shown to be very effective. So in 2009, 2 randomized controlled trials showed a change in knowledge and behavior related to abusive head trauma prevention. And in 2013, a study that was conducted in North Carolina found that shaking as a form of discipline was actually reduced by 50% with the Purple intervention. And in 2015, Purple was found to decrease emergency department visits for complaints of crying unrelated to physical illness by 29%. And this actually led to a reduction in emergency department visits, which led to a hospital cost savings of 18%. In 2018, one of the most important studies supporting the program was published. It was an 8-year outcome of implementation study, and it revealed that Purple was associated with a 35% reduction in abusive head trauma in children under 2 years old. Following that article, there was a cost effectiveness study that was published in 2019, and it found that every dollar spent on Purple had an associated $54 savings by society. In 2021, a study was conducted on a population of Hispanic mothers, and it found that their knowledge of normal infant crying patterns was improved through the delivery of Purple. And one of our latest studies was published in December of 23, and it found that hospitalization rates for physical abuse in children under 2 years of age decreased by 30% in British Columbia after Purple was universally implemented. Another study that's interesting, it was conducted on home visiting programs and components that produce positive impacts on home visiting programs' effectiveness. So the Period of Purple Crying program actually involves the 3 most significant components in improving a home visiting program's effectiveness. So that includes focus on improving parental expectations of the child and parenthood in general, targeting parental responsiveness or even sensitivity to a child's needs, and of course, video-based feedback. And the Period of Purple Crying program has been recognized as an effective resource for organizations serving families under 1 year of age through multiple reputable organizations. So the California Evidence-Based Clearinghouse for Child Welfare, they are a nationally recognized database that's driven to help advance the effective implementation of evidence-based practices for children and families, and it's designed to prevent abuse and neglect from occurring. So it supplies information on resources for child welfare professionals, and currently Purple is the only abusive head trauma prevention program within the database that has research supporting its effectiveness at reducing cases. Additionally, the Center for the Study of Social Policy endorses the Strengthening Families framework as well as the Period Purple Crying program. And they've recognized that when used in conjunction, they can have a greater impact on new parent knowledge and help to build a more comprehensive family support strategy. So Purple's program messages and delivery method is consistent with the 5 protective factors of strengthening families, which are parental resilience, social connections, knowledge of parenting and child development, concrete support in times of need, and social and emotional competence of children. So the great thing about this program is anyone who serves families with infants under 1 year old or partners with organizations that serve families can utilize this program. So there's a wide range of professionals who come in contact with newborn families. And by having a multifaceted approach, we can ensure that these families in North Dakota are receiving this critical information and the necessary support. So the delivery model of this education has been researched for over 18 years, and the most effective method of delivering abusive head trauma prevention education is through an ideal 3-dose exposure approach. And I do just want to say that while the research shows a certain timeline, if you're unable to follow this timeline, it's okay. I'm just going to talk about the timeline just because that's what the research shows to be most effective. So the implementation of all 3 doses in a community just helps ensure that all parents and temporary caregivers receive critical messages and helps promote a cultural shift in the way that communities view infant crying, which really helps to essentially normalize it. So the program can even be effectively delivered in as little as 3 minutes in each of these doses. So dose 1 is directed at teaching parents and caregivers before their infant reaches 2 weeks of age, before infant crying starts to naturally increase. So in dose 1, parents or caregivers receive their Period of Purple Crying program materials. They receive an education session through a trained provider. This is typically in hospital discharge, prenatal classes, perinatal classes, or even home visiting. Dose 2 is a reinforcement approach that targets parents around that 2 weeks to 3-month period after a baby's birth during that high crying time. So in this dose, a trained provider reinforces the messages and or delivers the education to families who have not received them yet. So home visiting, well baby visits are just some examples, but really anyone could be a great fit for dose 2. And then dose 3 just really contains all efforts to reach the general population. So it's social media campaigns, just general advocacy and outreach, posters, billboards, flyers, anything like that. So some people aren't always sure if they're dose 1 or dose 2. And the easiest answer is you could be both. So if you are working at a birthing center, you would typically be dose 1. But sometimes the program can be given to a parent in a prenatal class. So you would then be dose 2. And vice versa, you could be a home visitor or community educator that doesn't see families until the infant's a couple of months old. So you would typically be dose 2. But sometimes people get missed at hospitals or other organizations who may not be doing the program. So really the only way to find out what dose you are giving the families is to just always ask. So ask parents and caregivers that you're educating. Start off by just seeing if they've received their own copy of Period of Purple Crying program materials. And if they have received them, then you would do dose 2. If they haven't, then you proceed with dose 1. So what are the steps for getting your organization set up to implement this program? Really, the first step is to get trained. There's a couple of options that you can upload the training into your own LMS. You can be trained by local trainers in your area, or you can always take it on our online website. So if you take it on our online website, it's 1 hour, it's free. It goes over the research supporting the program, as well as how to deliver the information to families in more depth. And also, if you're a nurse or social worker, this training qualifies for 1 hour of continuing education, and it's free. really the next steps are done by whoever is like an admin at your organization who would ever be spearheading the delivery of the program at your location. But so the next steps are just to read our implementation protocol. This just walks through the obligations of the program, which include the requirement for each family with a newborn to receive their own set of program materials. And then obviously signing our fidelity agreement. It is a non-legally binding document, but it just helps ensure that you'll follow the program delivery model and uphold its effectiveness at your organization, because not adhering to the fidelity can reduce the program's effectiveness. And the last step is to purchase the program materials for the families with newborns that you serve. So these can only be purchased through the National Center on Shaken Baby Syndrome, but Families Flourish does provide some support in this step, which Lindsay will be discussing next. And I did want to mention that the Period of Purple Crying can only be delivered to families as the app and booklet package. So altering the program materials, referring parents to a website, one that you create or even our own, only showing the video or acronym or crying curve to families without providing that app code and physical booklet, adding purple information onto flyers, handouts, or anything like that is a violation of our fidelity and copyright, and actually diminishes and waters down our research of the program's effectiveness. So the program does have to be delivered to families according to our implementation protocol and doses, which are laid out in more depth in our free online training. So some of you may be thinking right now, well, why do we have to buy the program materials? Why can't we just show the video or tell them about the crying curve and acronym? So that's because not only is the program model research and evidence-based, but the use of these materials were tested in an 8-year study. And it was actually found that both mothers and fathers were found to increase the use of these materials during that high crying period at home, which was around 2 months after delivery. So mothers' use of the materials more than doubled at home post-discharge, and 50% of fathers had read and viewed the materials by that 2-month mark. So that's why it's extremely important parents and caregivers have their own set of materials at home with them so they can review the information later, as well as share it with other caregivers of their baby. And also, one major benefit to implementing Purple is it actually shows potential cost savings to medical systems and to the general society. So to help with your understanding of the cost of abusive head trauma, this graphic is used to help visualize costs, specifically in North Dakota. So the red line shows the average lifetime cost of one surviving abusive head trauma victim, which is over $1 million. It's close to 2.6 million. And if the victim dies, it's actually closer to 5.7. The gray line in the graphic shows the cost of medical care alone for just one severely injured victim from around 2 months of age to 17 years. And it was around $260,000, about half of which was paid out of pocket by the family. And lastly, the purple line shows the cost to provide Purple program materials to every family with a newborn in North Dakota. And as you can see, preventing just one abusive head trauma case pays for prevention materials tenfold. So prevention is cost effective. So in summary, the Period of Purple Crying program is a research and evidence-based abusive head trauma prevention program. It's not only effective at reducing cases, but also cost effective. The program was linked to a 35% reduction in abusive head trauma cases and 30% reduction in general infant abuse, and can really effectively be delivered to families in as little as 3 minutes to not put a time burden on healthcare and other professionals. And I did just want to end by saying that there is power in prevention, and prevention is possible because of professionals like all of you. So thank you for listening to me today and learning a bit more about the Period of Purple Crying program. Please feel free to ask the questions at the end, as Lindsay said, but feel free to also email me or call me with any further questions about the program. Thank you.
Thank you, Chantel. That was amazing, and I learned some new things myself, so thank you. Once Chantel is done sharing, oh, there we go. I'm gonna get my screen up and talk a little bit more about the work we do here at Families Flourish ND. It's so nice to see all your faces again for a few minutes before we switch over. Give me 1 second. And then I will look to you guys for a thumbs up. Can everyone see yeah, we're good? All right. Well, I am so excited to share more with you about how we specifically work with the National Center and how we can support all of you here in North Dakota. First, I'm just going to take a minute to formally introduce myself, although I see lots of familiar names on this webinar. I do see some new ones that aren't as familiar to me, so just a moment to share a little bit more about who I am. The biggest thing I want to tell you is that I've been with Families Flourish ND for over 3 years. Much of my time here has really been focused on child sexual abuse prevention. However, that still remains a core part of my work, but I've recently had the opportunity to spend more time working with other important prevention initiatives like the Period of Purple Crying. But before any professional hat that I wear, I'm a mama. I have 4 kind, smart, beautiful girls at the bottom of the screen there. And outside of work and being a mama, I volunteer with a local nonprofit called Bio Girls. Some of you have maybe heard of it. It carries a mission that's close to my heart. I'm also an ordained minister, and over the past few years, I've had the joy of officiating 3 weddings, something I never expected to love as much as I do. But thank you for being here today and for taking a moment to learn a little bit more about who I am. I really wish I could stop sharing my screen and meet each of you and hear about the amazing work that you're doing across the state, but we don't have time to do that. But please don't hesitate to reach out. I'd love to connect with you. And with that, we're going to take a second to talk a little bit more about Families Flourish ND and the work that we're doing here. So Families Flourish ND, formerly known as Prevent Child Abuse North Dakota, also widely known as PCAN, has been a trusted advocate for children and families since around 1978. Our mission here is to ensure every child grows up nurtured, safe, and free from abuse and neglect. We lead statewide efforts through impactful programs like the Period of Purple Crying, like we're talking about today, the Handle with Care program, Authentic Voices, Child Sexual Abuse Prevention, McV, Baby Safe Haven, and more. These initiatives that I just shared support parents and caregivers and communities in building strong, healthy environments where families can truly flourish. At FFND, we believe prevention is possible, and together we can create a future where all children can thrive. So we proudly partner with the National Center on Shaken Baby Syndrome because we believe that children, especially infants, are among the most vulnerable members of our communities. One of the most critical times in a baby's early life is during the period of purple crying, as Chantel shared with us, a phase that can be incredibly challenging for caregivers. The period of purple crying is evidence-based and designed to educate and empower parents and caregivers with the tools they need to safely navigate this tricky stage. And as a Prevent Child Abuse chapter, we are committed to prevention through education, and this partnership reflects our shared mission to protect children and support the adults who care for them. So at FFND, our work with the Period of Purple Crying program is centered around 3 focus areas, and those are outreach and engagement, program integration, and reimbursement access. Together, these focus areas allow us to scale the program effectively, support long-term implementation, and ultimately protect the health and well-being of North Dakota's youngest and smallest residents. So we help support the Period of Purple Crying by connecting with healthcare providers, community organizations, and families across the state, whether it's through presentations like this or sharing educational materials, setting up booths at events, or simply just building relationships. Our goal is to raise awareness and spark meaningful conversations It's about helping people understand what the period of purple crying is, why it matters, and how we can all play a role in supporting parents and protecting infants. The next focus area is program integration. We work closely with hospitals, clinics, home visitors, community agencies to make sure the period of purple crying is integrated into their systems. That means helping staff understand the program, supporting them with any training needs, resources and materials, and making sure every caregiver receives consistent, meaningful education about infant crying and safe responses. For us, it's about making period of purple crying a standard part of how we support families from the very, very beginning. And lastly, reimbursement access. We also offer grant-funded reimbursement opportunities to help organizations cover the costs of period of purple crying materials. This process is still being worked out, but partners can simply submit proof of purchase along with completing a reimbursement form and receive up to a $500 reimbursement. So it's a straightforward way for us to make period of purple crying more accessible, sustainable, and easier to implement across different settings. But the biggest thing I really want to relay is that FFND is currently in the process of revamping the reimbursement procedure. So I appreciate your patience with that. We'll be sending a follow-up email to all of the attendees on this call with clear details and next steps for how to claim that reimbursement. So please stay tuned. Here are some powerful testimonials that speak to the impact of the power of purple and the incredible work being done right here in North Dakota. These voices reflect the real differences period of purple crying is making in the lives of families and in communities. We're also proud to share that in 2024 alone, over 6,400 educational materials were ordered, an amazing testament to the growing reach and importance of this initiative. I'm going to leave this slide up for a moment so you can take in the feedback, feel the momentum we're building together. I know I speak for the agency and for Chantel, but we are so grateful to our allies and champions, and thank you for being a part of this movement. One thing I wanted to just take a brief minute to speak on is the Purple Hat campaign. It just holds a very special place in our hearts. This campaign is more than just a creative effort. It's a powerful initiative aimed at protecting our most vulnerable, our newborns. The campaign invites knitters and crocheters to create purple baby hats, which are then distributed to families of newborns. But these hats aren't just like a cute little accessory. They serve as a visual reminder of something incredibly important, the period of purple crying. I have a couple hats here. I'm not even sure if you guys can see me, but I'm holding up some of our little hats up. The hats are paired with educational materials to help parents and caregivers understand what to expect and how to respond calmly and safely during this time. And I just want to take a minute to say how deeply grateful to the Bountiful You, to many generous knitters and crocheters who have donated their time and talent, Erin Kidsman for her unwavering support and coordination of this effort. They're making a real difference in raising awareness and supporting families across North Dakota. And I don't have a total number of hats that have been created and distributed, but I know that many hats have been shared. And so thank you for being a part of this meaningful mission. There are simple and meaningful ways each one of us on this call today can support the period of purple crying and help protect babies and help support families. And so here are just a few ways that we would encourage you to be involved right where you're at. So the first is learning and sharing. So by being a part of this webinar today, and by taking time to understand the period of purple crying and why it matters, and then in turn, sharing what you learn with friends, family, on social media to help spread and raise that awareness. You can advocate for awareness, encourage local schools, libraries, community centers, organizations to include period of purple crying materials in their programming, talk to local leaders about supporting period of purple crying initiatives. One of the biggest things we can do is model calm and supportive behavior, being a role model for new parents and caregivers, showing empathy, offering help and support, and demonstrating how to respond calmly to infant crying. My sister is due with her first baby in a couple of weeks, and I plan on doing all of these things with her and her husband. And then just knowing the signs and sharing the message, understand the signs of normal infant crying and the dangers of shaken baby syndrome, and help others recognize that crying is a normal part of development and that support is available. So I just want to say on behalf of FFND, thank you for taking time to learn more about the period of purple crying. I truly appreciate your interest and your support in helping raise awareness and protect our littlest community members. But we're not quite done yet. I'm excited to introduce our next speaker, who's going to be our partner highlight. It's my pleasure to welcome Tara. Tara is a child protection supervisor for the RSR Human Service Zone, serving residents of Ransom, Richland, and Sargent counties. I am so grateful that she agreed to take a few minutes to share how they educate families around the period of purple crying in the communities they serve. This was kind of a last minute request to Tara, so I'm just grateful that she's here to talk with us a little bit more about what they do. I believe her insights will show how the program can be adapted to meet the unique needs of each and every community in which we're serving, proving that there isn't a one-size-fits-all approach to implementation. And with that, I just like to welcome Tara.
Hi, thank you. Can you hear me okay?
Yes, we sure can.
Okay. So like Lindsay said, I'm the CPS supervisor at RSR. I've only been in the supervision role for about the last year, but prior to that, I've been a child protection worker for more years than I'm going to admit to. So we utilize it. We all do the training. And then whenever we get cases, especially like our PSI cases, which is substance exposed infants, we bring what we call a PSI packet. And within that packet, we have all the literature on the period of purple cry. We review it with the families. We review safe sleep spaces. We talk about them identifying in advance support systems that they can reach out to in the community, people they can maybe call, just to kind of prepare for those times when baby doesn't stop crying and their nerves are at the end. We also encourage parents to be okay with allowing their baby to cry, to place it in the crib, shut the door, maybe step out of the room, take a few deep breaths, make a phone call, turn on some music, and just reminding them. I know when I was out on the road, like doing actual CPS work, I would remind them that shaking a baby to the point of death, that's final. Sometimes I think people have to like hear the hard truth, like you can't come back from that. And then we also do that with just any family that we go into the home, whether or not the report is regarding the infant, we'll address all of that with any parent with a child under the age of 1 year of age. So, and I think all my workers have done the training. I know we just recently realized that the foster care workers aren't as aware of all of that. And so they were encouraged to attend this as well and to take the training online. But so.
Thank you so much, Tara. It's nice to have the various perspectives and get an idea for the different work being done and the different professionals utilizing and implementing the period of purple crying. We appreciate you sharing that with us. We're so grateful for the work that you and all of your team do.
Thank you.
Yes, thank you. Before we open up the conversation for questions, I just want to say thank you again for tuning in today. When we come together, whether it's healthcare providers, educators, community members, and leaders, and all of us on the call today, families, we create a powerful network of support. And by sharing knowledge and standing united, we can protect our most vulnerable and ensure that every parent feels empowered, not alone. together, we truly make prevention possible. So again, thank you so much for spending the last 50 minutes with us. And please feel free to ask, and you can unmute or put your questions in the chat box for Chantel, Tara, or myself. It doesn't look like there's any questions. But at any time, please feel free to reach out to myself, specifically in North Dakota, or Chantel with any questions you have along the way. But we're here for you, and we're here to help with implementation as best we can. And thank you guys again so very much. And please reach out with any questions you have. Have a great day.